Good evening and welcome to our COVID-19 update, a special edition on Channels Television. I'm Millicent Walker. It's a 30-minute daily update on the coronavirus pandemic in Nigeria and across the world. Here are some of the highlights. Today, police test negative to COVID-19 after self-isolation. And despite the appeal for a global ceasefire, the world faces a common enemy, COVID-19. Fighting and shelling continues in Libya. President Task Force gives update on COVID-19 as Aviation Minister explains category of essential flights to operate. And we also have some celebrities appealing to citizens to obey stay-at-home order to save lives. Some of the highlights we have for you today. But as of now, the total confirmed cases, according to the Nigeria Center for Disease Control, is 135. According to the NCDC, of the 4 new cases, 3 are in Osun State and 1 in Ogun State. A state-by-state breakdown now shows that Lagos has 81 cases, the FCT 25, Oyo 8 cases, Osun has 5, Ogun 4 cases, Kaduna has 3, Enugu, Edo, Bauchi have 2 cases each, while Ekiti, Rivers and Benue have 1 case each. The country has recorded 2 deaths from the virus. And now the federal government will be deploying an expert on infectious diseases from the Irua Specialist Hospital that's in Edo State to Abuja to help in COVID-19 case management. Now, this is one of the measures towards containing the pandemic outlined by the Minister of Health at the media briefing. Now, the minister who confirmed the 135 cases of the disease recorded in the country also says 5 of the cases have been treated and discharged. According to him, more laboratories have been opened and more testing machines will be available in the weeks to come.
As of today, the 31st of March 2020, we have recorded 135 confirmed cases of COVID-19 in Nigeria, of which 81 are in Lagos, 25 in the Federal Capital Territory, and 8 in Oyo, 4 in Ogun, 2 in Bauchi, 2 in Edo, 2 in Osun, 2 in Enugu, and 1 each in Benue, Ekiti, Kaduna, and Rivers. 5 persons have been discharged home after successful treatment. Nigeria has unfortunately recorded 2 fatalities, and both of them had underlying illnesses. Additional strategies are being developed to intensify contact tracing, to support prompt case detection, isolation, and treatment in order to reduce the spread of this infection. The Nigeria Center for Disease Control has engaged hundreds of ad hoc staff to support call centers, contact tracing, and laboratory work. Happily, many retired staff of NCDC and also of the Ministry of Health have reported for duty. Training is ongoing for medical personnel to support overall preparedness and treatment. We are preparing about 1,000 beds in Abuja to be used immediately as isolation centers if the need arises. The capacity to increase bed space is present. Resources for procurement of required commodities have been provided. More testing sites have been opened in Ibadan and Abakaliki, while existing laboratories are being optimized in their performance.
Well, also at the briefing, the Minister of Aviation explained some exemptions given to restrictions placed on all flights, local and international, for the lockdown period.
All airports have been closed to contain this evil, including local airports, arising from the intent of government to continue to keep close tap on this disease and to exterminate it. However, certain flights that are considered to be essential will continue to happen. So Nigerians will continue to see aircraft flying. But those aircraft are qualified. Distress, inside to save life is allowed. Aircraft on technical stop, meaning that an aircraft overflying perhaps the airspace of Nigeria, needing to stop to pick fuel somewhere and continue with the journey, perhaps it's traveling to supply some medical equipment to some countries and some communities, that kind of technical stop will be allowed in our airspace and airports. Also, medical evacuation would be allowed, and also cargo will be allowed. These cargo are essential cargos, not just any cargo. Certain diplomatic flights will be allowed. Certain humanitarian flights, those bringing in food items and other humanitarian supplies, medicines, medical equipment, etc., and also security flights.
Well, just before the ministers gave further clarifications, the Secretary to the Government of the Federation, Mr. Boss Mustafa, gave the assurance that the Presidential Task Force on COVID-19 will be meeting with security heads to fine-tune enforcement modalities as well as exemptions to the stay-at-home order.
Today we have just begun the first day of restrictions in Lagos and Ogun State and the Federal Capital Territory, Abuja. We are observing developments around the country as we receive reports that are being filed in. The Presidential Task Force has, however, met with security chiefs to smoothen rough edges of implementation within the first day of implementation, and we are working on issuing an appropriate restriction protocol and exemption guidelines which will guide the subsequent days of restrictions. Initial feedback is that there is substantial compliance, but however, there are violations of those restrictions by citizens that we desire to protect. Let me emphasize that the decision to lock down is to prevent community spread, which may be dangerous to manage. It can only be done by Nigerians and for Nigerians. So we would want to use this medium to implore our people and plead with them to please respect and honor restrictions that have been imposed for the good of our people and our nation.
In the meantime, more high-profile Nigerians have continued to test for COVID-19, the latest being the Inspector General of Police, Mohammed Adamu, whose result came out negative. About 11 of the IGP's officers whose blood samples were collected also tested negative. In a statement by the force's public relations officer, Mr. Frank Mba, policing is a high-contact job with its risks, and the police boss is calling on all police officers nationwide to adhere strictly to precautionary measures in the course of their duties, while calling on members of the public to obey restriction orders by constituted authority. And now, even though Lagos State has the highest number of confirmed COVID-19 cases, the state is stopping at nothing to stop the spread. Now, at the press briefing today, the Lagos State Commissioner for Health, Professor Akin Abayomi, confirmed that the isolation centers are fully functional and producing desired results. He also explained the importance of the lockdown, appealing to Lagosians to comply with the directive.
Our survival in Lagos so far is 100%. 100 out of 100 are still alive. And out of those patients, we've discharged 8 fully recovered. And we will soon be discharging in the next week as their tests come back negative. Remember, I said we have to have 2 negative tests, because if you have 1 negative, sometimes you become positive again for a few days before you become fully negative. So just to protect the community, we're making sure that you have 2 consecutive negative results. So a lockdown is just essentially to grind down movement in a city, to minimize it to as much as we can. It will never be 100%, but our job is just to slow it down to as much as we can. We don't want to come out with, security brutality. We don't want to demonstrate. This is not a military state. We're a civilian democracy. Children will be children. We discourage it, and when we see it, we would advise against it. But also, as civilians, we must play our part in this whole process of lockdown and social distancing.
In the meantime, Nigeria's president has signed the COVID-19 Regulations 2020, declaring coronavirus a dangerous infectious disease. The presidency says the decision is an exercise of the powers conferred on him by Sections 2, 3, and 4 of the Quarantine Act, Cap Q2, Laws of the Federation of Nigeria, 2004. The statement was tweeted by the president's aide, Bashir Ahmed, who says the regulations, which will be effective immediately, also gives legal backing to the various measures outlined in the president's national broadcast as of 29th of March 2020, such as the restriction of movement in Lagos, the FCT, Ogun State, and others towards containing the spread of COVID-19. Our correspondent Terry Kumi joins us live from the Federal Capital Territory. Terry, tell us about activities. We hear you've been around Abuja earlier today, especially the task force on the stay-at-home order to curb the spread of COVID-19 in Abuja.
Well, hello, Ms. And yes, I did take a tour with them. But first, let me start by telling you that the entry and exit points were closed today, and they will remain closed in line with the directive of the president. So earlier today, we joined one of the teams from the FCT Compliance Task Force on a tour to some parts of the city. Now, that task force is made up of security agencies, as well as the VIO and the FRSC. And interestingly, the security operatives were heavily armed while on that tour, even though many would question the necessity. Now, the different teams, that's 5 in number, were directed to different locations in the FCT. On that tour, we did observe that shops, markets, businesses were all closed. In fact, on the tip-off that a business center was open, the team moved to an area in Mabushi to handle the situation. Now, it turned out that it was a telecom service provider, and they provided documents showing that the Inspector General of Police gave them approval to operate. And while we were leaving Mabushi, we observed that some persons were just sitting outside and having a conversation like it was a normal day. And the team leader had to disperse them, but first he addressed them and told them that the stay-at-home order is exactly what it is, no outside interactions. We also observed that some herders were also compelled to turn their cattle around. Now, here's what I can deduce from that tour. Most persons probably do not understand that the stay-at-home order does not involve visiting friends or having conversations outside. Another thing is that some persons who are exempted from being on essential duty either picked up passengers with their vehicles who are not exempted in that order. And specifically, security operatives were fingered in this. We also had a case where a taxi driver would pick up a journalist and seize that opportunity to pick up other non-essential workers. Well, in all, the leader of the task force gave the FCT a rating of 85% and insists that enforcement will be a 24-hour thing regardless. No one should think that at any point in the next 2 weeks the momentum will drop. No. And I must say that with that kind of resolve, we will most likely see an improved level of compliance in the FCT.
Before we let you go, because we have to quickly go on a break, validate for us. We hear each House of Reps member is perhaps resolving to donate 2 months of their salaries.
Oh, yes, that's true. Very true. We just got that statement from the Speaker's office this evening. And the Speaker made emphasis that this does not stop each rep member from making extra donations. But some people were questioning the timing of this, saying as they had to wait till the Senate did its own donations. I would like to remind you that the House, a lawmaker in the House of Representatives did suggest to them way before they took that break that they should make these donations.
Many thanks, Terry Kumi, our correspondent in the Federal Capital Territory. Still to come on our COVID-19 special update, Nigerian celebrities are speaking about the stay-at-home order and what other Nigerians should do. You join us again. This is Lagos State, where the enforcement of the president's order movement appears to have taken effect, with various agencies at major areas in Lagos State ensuring full compliance to the stay-at-home directive. Earlier today, there was traffic build-up on the Lagos-Ibadan Expressway as security operatives mounted barricades to check vehicular movement. Now that is the Kano State Governor, Abdullahi Ganduje, leading the line in the enforcement of the state's travel ban and land border closure. Today, the governor personally inspected the enforcement of the interstate travel ban in and out of the state as a precaution against the spread of COVID-19. The governor's convoy stopped at major entry points, we're told, to the metropolis, where he stopped several trucks loaded with people from Lagos and Abuja, states with the highest numbers of COVID-19 cases. Well, let's talk some more about this pandemic, and joining us to dissect it in Nigeria is Dr. Fiona Braka. She's the country officer for the World Health Organization. We'd like to thank you for joining us this evening. Now, it appears to be a waiting game across the world and in Nigeria. What's your assessment of how we're doing in Nigeria?
The current epidemic is evolving globally. We are seeing an increase in the number of cases, and we are also seeing an increase in the geographic spread. More countries are getting confirmed cases. We currently have 205 countries reporting cases across the world. And this is still on the upward trend, and therefore countries need to prepare adequately. Those that have not detected any case need to prepare for the first case. Those that have cases need to prepare for the first cluster and for the first community transmission episode. In the case of Nigeria, once WHO was notified of a cluster of pneumonia cases in China at the end of 2019, Nigeria was identified as one of the potential high-risk countries in the region. And that kick-started a process for preparedness to try and build up on laboratory capacity for testing cases. And we then had 5 testing centers set up in Nigeria before the outbreak actually happened. There was also a process to prepare states, high-risk states, for potential importation of cases. So sensitization and training of medical personnel at the points of entry was done. And once the first case was detected, the country rapidly moved into motion, implementing the plan that was already in place for detection of cases and containment. And we have seen the response gradually pick up and is now really at a full-blown phase. So we commend the efforts that the government put in place in terms of preparations. And now we have an outbreak that is increasing. we need to ensure that the measures that are recommended for the response and for preparedness in states that do not have those cases are put in place promptly.
Talk to us about the race to finding a cure or perhaps a vaccine, and how we should go about it here in Nigeria or Africa, especially to break the chain of transmission, to flatten the curve that we're seeing.
So WHO recommends a comprehensive and blended approach to stopping this virus. And based on what we know, the way the virus is transmitted, we need to ensure that there are different aspects of the response are implemented. So physical distancing, for instance, is one of those. This helps to try and limit contacts between human, person to person, so that they reduce the risk of coming into contact with the droplets or into contact with contaminated surfaces. And then, more importantly, that you use the period such as the lockdown we are in currently to allow the health system to get on top of the response. So that means timely detection of suspect cases, testing, isolation in designated facilities for care, and also contact tracing and quarantine. So it is a comprehensive and blended approach that is necessary for the stop of the outbreak. And to date, we do not have treatment for COVID-19, and we do not have a vaccine. We currently have over 50 vaccine trials that are in place, trying to work round the clock to fast-track the vaccine development process, and we continue to keep countries informed of that process. And when it comes to treatment, WHO is leading a multi-country clinical trial. So far, 45 countries have signed up for that. It is what we refer to as a solidarity trial that is going to test different drugs in 4 different arms against the normal standard of care that we are currently implementing. So all this is
Doctor.
Being fast-tracked at the global level, but as we speak to date, we do not have any treatment or vaccine available on the market.
Thank you so much for your insight on this issue, Dr. Fiona Braka, Country Officer for the World Health Organization here in Nigeria. We take you to Edo State, where the governor, who has been in self-isolation for some days now, has made a state broadcast today where he asked indigents of the state not to be complacent in compliance to efforts taken to spread the COVID-19. Governor Godwin Obaseki also announced more precautionary measures against the virus in the state.
Over 100 screening points across all local government areas made up of teaching hospitals, general hospitals, primary healthcare centers, and private hospitals. Anyone with known symptoms or suspects that they may have been exposed can go and talk to a trained healthcare worker who will provide care according to the defined protocols. This is offered free of charge to our people. We are working closely with the IRUA Specialist Teaching Hospital, one of the 6 designated testing centers in Nigeria, to expand their capacity so that they can test more people. Additionally, we are planning to open a new specialized testing center in Benin City. We now have isolation centers with a total of 280 beds located at the Stella Obasanjo Hospital, Benin, University of Benin Teaching Hospital, IRUA Specialist Hospital, and Auchi General Hospital. In addition, we have secured 25 additional ventilators, increasing the total number of ventilators to 28. 10 intensive care units now exist in the state to take care of critical cases. I chair the Edo State COVID-19 Response Committee, which meets daily to evaluate and review all the latest developments as it relates to COVID-19, while the Deputy Governor is chairman of the Technical Committee. The COVID-19 virus does not move. It is people that move it and then spread it. You can stop its spread
by maintaining social distancing and stay at home, while the healthcare workers do their best in containing the virus.
Now, some Nigerian celebrities and movie makers have joined government in urging citizens to stay safe and stay at home. Our entertainment correspondent Bidemi Diary visited some of them today and reports that they are as concerned as any Nigerian on containing the spread of COVID-19. Well, that's it on the program. We'd like to thank you for watching. Don't forget to send us updates with regards to what you're doing this period. Tweet at us at Channels TV. We have another update coming your way at 9 p.m. Do join us then. I'm Millicent Walker. Bye for now.